Hey everyone, this is Grace here. I hope you all are doing well. Does anxiety cause chest pain? Yes, it does cause chest pain. Chest pain can be a very alarming and it is a very common symptom in people who suffer from anxiety. The chest pain can be of different types. It can be a dull pain, it can be a stabbing pain, sometimes it's a pinching pain, or you feel as if a weight has been kept on the chest. Once you know that there are a lot of causes to this chest pain and anxiety, and these causes are not related to the heart, there are a lot of non cardiac causes to anxiety, chest pain. I think just that knowledge, just that information can help us relax, can help us respond. The next time the chest pain comes, we will be better responding to the chest pain in a more calmer manner, without adding fear, without adding panic, without thinking that, oh my god, it's my heart again. So let's understand what are the causes of the chest pain. The first one is poor posture. When a person is anxious, we often tend to sit in a slouched position with our shoulders hunched, and we tend to close in on ourselves because the fear, that's what the fear makes us do, right? In fear, we're always sitting in this position. There's a lot of tightness without us consciously doing it. But yes, that tightness, that poor posture, that slouched position itself tends to cause the chest pain. What you can start doing about this is be more mindful about your posture. Check your posture several times in the day. Try to keep the spine straight, open up the shoulders, keep the neck relaxed, keep the shoulders relaxed, and remind yourself several times a day to keep checking your posture. The second reason is hyperventilation. Hyperventilation is when you're breathing quickly. So you're taking a rapid and a shallow breath in and a rapid and a shallow breath out. Now, when you're breathing this quickly, of course, your chest is also doing that movement, right? So the quick inhalation, exhalation is making your chest overwork. So the chest muscles are simply being overworked and fatigued. And what happens to a muscle when it is fatigued? It hurts, right? Imagine that let's say you go to the gym today and you work out your lower body, and the next day you have soreness. That's expected, right? What is going to be your response? You'll be like, yes, I worked out yesterday, so today my lower body is sore. You're not going to get anxious and start Googling what causes lower body pain, what causes thigh muscle pain, or you're not going to go to the doctor saying that something is wrong. It's expected. But when you're hyperventilating, we don't realize that we're doing this because we think that we are breathing normally. So, why is the chest pain coming? And our mind thinks heart. But it's just that it's a normal way of breathing when you are anxious. We tend to hyperventilate because our body is not relaxed. So, when you are in that fight or flight mode, you tend to take shallow, quick breaths in. And that fatigue, that overworked muscle is just naturally going to cause pain. The intercostal muscles, the muscles between the ribs, the back muscles, the neck muscles, all of these go into fatigue and cause pain. So hyperventilation is another cause. Another thing that happens in hyperventilation is you tend to exhale out carbon dioxide very quickly, and this tends to cause a loss of balance in your blood gases. This is often what causes the symptoms of headache, dizziness, and the chest pain as well. So hyperventilation from that point of view also causes the chest pain. The third reason is excess adrenaline. Excess adrenaline is actually at the root of all of these complex symptoms that you experience in anxiety. What happens is when you're going through anxiety, your body secretes stress hormones out of the blue. You may not be actually going through any stressful situation, but the body perceives that there's danger and it just keeps pouring stress hormones into the system. These stress hormones are mainly adrenaline and cortisol. And any hormone has an effect on the body, right? It produces some changes in the body. What adrenaline and cortisol do is that they increase your heart rate, they increase your respiratory rate, thereby causing hyperventilation, what I just mentioned. They also cause muscle tightness. They also cause a lot of other changes, like they prepare you for basically going into the fight or flight mode. So excess adrenaline is one of the commonest, one of the biggest reasons for causing chest pain. Also, if you have experienced a panic attack, the day that you have experienced a panic attack, there is a surge of adrenaline and cortisol. What is a panic attack? A panic attack is a sudden episode of intense fear. And what leads to this is when the adrenaline surge is very high, and this leads to a lot of tightness, so much so that you will notice that it takes you sometimes 2 to 3 days or even up to a week for all the muscle tightness to start reducing and for you to start feeling some sense of normalcy again. So this is all about the excess adrenaline. The fourth reason could be gastric causes. You may have heard that the stomach or the gut is actually called a second brain, and anytime you're experiencing anxiety, inevitably you will have some gastric symptoms. For a lot of people, the gastric symptoms are the main symptom of anxiety. The gastric symptoms could be acidity, nausea, a feeling of diarrhea, or constipation, or just IBS where there's a lot of bloating and they're not able to understand, in spite of eating the most simplest food, it's causing bloating. One of the things that happens in anxiety is that you may have acid reflux, and this reflux, where you feel that where the acid is actually moving upwards, can cause a sensation of burning, and you may understand it as chest pain. You may think that it's pain which is coming from the chest, whereas actually it's the pain which is coming from the abdomen due to the acid reflux. Another thing that happens when a person is going through anxiety is sometimes your esophagus or your food pipe may go into a spasm. This spasm is happening because of the excess adrenaline and the excess cortisol, but because of that spasm, you are unable to eat, you're having nausea, you sit to eat, and within a few bites you feel as if it's too uncomfortable, you feel uneasy, you feel you need to stop eating, you've lost your appetite. And also this spasm tends to cause a sensation of pain in the chest. So esophageal spasm and acid reflux could also be one of the causes of chest pain. The fourth cause is absolute lack of exercise, no stretching, no yoga, no nothing. What happens is when a person has anxiety, very often it brings with it cardiophobia, where you're afraid that something is wrong with your heart, or it brings with it health anxiety, because it's natural, it happens. You have so many physical symptoms that you are not convinced it's anxiety. You feel that there's something wrong in your body which the doctor has not been able to diagnose. So you think that it's better to just relax, to take it easy, and yes, you'll start exercising once you get better. But that's not how it works. Once you have been told you have anxiety, start slow but start exercising, start doing yoga, stretching, all of those things, because lack of any of these things, lack of stretching your muscles, lack of exercising, that itself is contributing to the chest pain. Remember, when we exercise, our body releases endorphins. Endorphins are natural mood elevators. They will reduce the anxiety and start making you feel good. Also, when you're doing things like yoga or when you're stretching, it releases the tension which is pent up in the body, which is pent up in the muscles. So lack of exercise is a common cause, and make sure that you start exercising so that it reduces your incidence of chest pain. The sixth cause is just being hyper aware of every sensation in your body. When you have anxiety, we tend to be hyper aware of every little sensation, every little movement in your body. And when it comes to the chest, if you have had palpitations, or you've had a high heart rate, or it's come with panic attacks and anxiety attacks, then there is a lot of awareness on the chest, and that's only natural, right? Because the heart is there, and the heart is such a vital organ. So it's not without reason that cardiophobia or fear of something serious happening to the heart is a common symptom in anxiety. But if you're going to be so hyper focused just on one part of your body, then every tiny little movement, any flutter, any twinge that happens there is not going to go unnoticed by you. Just imagine that your doctor tells you that, I think something's wrong with this hand of yours and I want you to be watchful of it. And if you notice any symptoms, report to me within a week. What are you going to do? First of all, you're going to be scared. You're going to be very alarmed. You're going to be frightened, and you will forget about everything else in your body and just focus on this hand. And within an hour, just in a span of 1 hour, you will notice that this hand goes through at least 100 sensations. Sometimes there is some twitching, sometimes you feel a crawling sensation somewhere, sometimes one part will feel warm, one part will feel cold. That's because we are focusing so much of our attention there. So when you have, once you've been checked by your doctor and told that nothing is wrong with your heart, you've been given a clean chit that your lungs are okay, your heart is okay, and the chest pain is being caused by anxiety, try to distract yourself and not hyper focus so much on every little sensation that you experience in the chest. So these were the various causes of chest pain in anxiety. I hope that this video has been helpful. I suggest you make a mental note of what are these various causes that we spoke about, and next time you have chest pain, you just remind yourself that hey, it's probably just muscle tension, or it's just the reflux which is causing the chest pain, and that could probably help you to relax and not respond with fear when the symptoms come. I'll see you in the next video. Till then, take care.